Assalamu alaikum and a very good afternoon to you all. I welcome you all to this webinar series on policy dialogue. I'm Nasreen Panjwani, senior instructor at the Aga Khan University School of Nursing and head of the outreach projects here at Sonam. So I would be starting this program, and I have Ms. Salima Gulzar. She is the assistant professor and stream lead of public health at the School of Nursing. Today is the first webinar of the series on policy dialogue from the outreach unit of Aga Khan University School of Nursing and Midwifery. Here, we will invite nurses and midwives from leadership positions and have a dialogue with them about and around policy. So please stay tuned, and we will make announcements for future such dialogues in the year to come. I would take the privilege to introduce Mr. Wais Qarani in today's session. Mr. Wais Muhammad Qarani has completed his Bachelor's of Science in Nursing in 2009 and Master's of Science in Nursing in 2015 from the Aga Khan University School of Nursing in Karachi, Pakistan. Mr. Qarani has an extensive nursing management experience in education and healthcare in various institutions and in different capacities. Since April 2011, he is serving at the French Medical Institute for Mother and Children in different capacities, and currently he is the administrator for the Division of Nursing Services there. Mr. Qarani has also worked with JPIGO as technical advisor to the Aga Khan, to the Afghanistan Midwifery and Nursing Education Accreditation Board, and he served at the Aga Khan University programs in Afghanistan as nurse educator. Besides this, he leads and facilitates in various small-scale quality improvement projects at FMIC. Mr. Qarani has more than 10 scientific and conceptual publications in various international journals. Mr. Qarani represents the Division of Nursing Services at FMIC, the French Medical Institute for Children, Mother and Children, at different national and international forums, such as National Task Forces on Nursing and Midwifery, International Quality Improvement, Collaborative for Congenital Heart Surgery, Children's Heart Link in USA. At FMIC, he is a trained auditor for ISO 9001:2015, Quality Management System and Joint Commission International Accreditation Standards. As part of his voluntary services, he served the Aga Khan University Alumni Association, Afghanistan chapter as president, and he is currently the president of the Afghanistan Nurses and Midwifery Council. I would invite Mr. Wais Qarani for his presentation.
Thank you, Ms. Nasreen. Hello, everyone. Good evening and assalamu alaikum. First of all, I would like to take this opportunity and thank the Aga Khan Sonam leadership for this opportunity to talk on this important topic and agenda. Thank you, AQ, thank you, the leadership, and I would also like to thank all the participants and welcome them for their time and interest in this session. I will take you to the presentation to these slides. If there is anything need clarification, maybe at the end we can elaborate and further discuss on those agendas. So the main focus of this presentation will be, we will be talking about regulation, how the nursing and midwifery education and services to be regulated in a country. Along with that, I would also share little brief information on the country's profile and the current situation of the Afghanistan, and at the end we will take questions, and if there is any clarification needed, we will talk on those areas. As you all know that Afghanistan is a landlocked and mountainous country and connects South and Central Asia. And the estimated population of Afghanistan is estimated to be 33 to 38 million, and we have 34 provinces and the capital of the country is Kabul. As you see in the map, we are largely connected with Pakistan, then Iran, and we are also have border with Turkmenistan, Tajikistan, Uzbekistan, also with China. In regard to the current situation, you people may have watching the TV that there is a political and economic turmoil in the country, and people are living in uncertainty about the future of the country and also about the future of their families. On August 15, as you all know, that Taliban has taken over from the previous government, and with that, the international community and the donors have drawn from the country, and the funds which were given to different international community are suspended at the moment. Our healthcare services mainly donor dependent. So with that, there is a closure of number of healthcare facilities, and people, nurses, midwives, doctors, and other healthcare professionals are losing their job. Migration is a big concern. People are migrating to other countries, and there is a brain drain, and mainly these people are educated people, and also those who are in a better economic situation. So there is a brain drain, and also the money is also draining from the country with them. Gender segregation is another concern at the moment. The hospitals, schools, and the universities, the new government is planning to segregate male and female in these institutions. Yet the schools and universities for the from the secondary have not been started, but yes, the primary schools have been started, but yet not the secondary and the universities, which is a big concern, and people are uncertain what will be the future of their children. And there is always social restriction these days. Although we are hoping for the best, news are coming that the government is working to improve on these areas, but currently we are hoping for the best. In regard to the nursing, nursing in our country in 2020, there was a survey which was conducted by WHO, which shows that in total we have only almost around 6,000 nurses who are active in the country, and they are working in healthcare system. This is actually composing only 31% of overall healthcare workers in the country, which is almost 3 times lower than what is expected. As you know, that WHO reports that 59% in other institutions and organs report that 75% of healthcare workers are nurses worldwide, but in Afghanistan, unfortunately, it is vice versa. You can see that our education is still diploma level. We have few limited programs of bachelor in the country, and you can see that the projection for 2030 is, you can see the number, how what the difference and variance is from 2017 till 2030. It means that in terms of quality and also in terms of quantity, the nursing profession needs a huge investment. In regard to the midwifery, the report from 2020 indicates that we have almost 35,000 midwives in the country, among which only 6,000 are working midwives, and the rest are either jobless or they are working in other professions or non-professional activities. If we talk about the structure of the nursing and midwifery in Afghanistan, luckily very recently in 2020, we were able to establish the Afghanistan Nurses and Midwives Council to regulate both the professions. Along with that, within the Ministry of Public Health, we have the Nursing and Midwifery Department, and we also have the professional associations, both for nurses, ANA, and for midwives, Afghanistan Midwives Association. As I shared, in regard to the higher education, unfortunately, we have only one BScN and one BScN program in the entire country for the entire population, which is not, covering the need of the country and the nurses and as I said that still number of programs are training diploma level nurses and midwives, although the diploma level education is phased out in many countries, but still in Afghanistan you can see particularly in the private sector we have 85 nursing programs and 148 midwifery programs, which are unfortunately until now they are producing nurses, and we are really concerned about the quality of their education. So why it is important to talk about nursing and midwifery, and why it is important to investigate on nursing and midwifery, on nurses and midwives? Actually, we all know that numerous studies have shown the relationship between patient outcome and the quality and the number of nurses and midwives. If you want a better patient outcome, if you want a better maternal and child health, then we need to consider a better work environment, a better education for the nurses and midwives. And this is what Dr. Tedros also emphasized, that we simply cannot achieve universal health coverage in the health-related targets and the SDGs unless we empower and equip nurses and midwives and harness their power. So this is how it is important that we should invest on nursing and midwifery. In regard to the regulation, see in Afghanistan, we had two associations, particularly the Midwifery Association is the best association in the country, the best empowered association we had since 2005. Along with that, we also had the Nurses Association from 2016 in the country. And since then, 2001 and then 2005, international agencies, importantly AQ, Afghan University, invested on nursing particularly and also on midwifery through other funding agencies. And the curriculum was revised and developed even initially, then revised number of times. But the main concern at that time was the regulation. We had a better education. We also had the advocates for the profession, but we did not have the regulation. So we in Afghanistan needed to develop the regulation, which is the universal or worldwide need for a profession to be regulated. And this is what the ICM and ICN emphasize that, and this is the direct quote from the ICM, that the primary purpose of regulation of any profession is to protect the public. So for that reason, we needed this regulation, the Afghanistan Nurses and Midwives Council, to establish and to regulate the nurses, the nursing and midwifery profession in the country. If I would talk on the history of the council, how it was established, almost we spent a decade from 2009 till 2018 to convince that we should have a regulatory body in the country for the nursing and midwifery profession. So this advocacy was led by the Afghan Midwives Association along with other partners and individuals. And the first workshop was held in 2019, where a strategic plan was developed to how to go for the development of this council. Here, people from Afghan University and also from the Pakistan Nursing Council were also invited to help in this regard. During this 1 decade or 9 years of advocacy, we faced a lot of political influences from different agencies. Even the WHO initially was not agreeing to have the Midwifery Nursing Council. At the same time, the Afghanistan Medical Council was established and that had its own influence. We all know that there is, in most of the country, there is doctor dominancy. So there was an idea that the Nursing and Midwifery Council should be a sub-committee or whatever of the medical councils. This is how the nurses and mainly the midwives play their role and advocate that we need an independent and autonomous body for the regulation of nursing and midwifery associations. So I'm talking about law and regulation, and it is better to know that what is the difference between these two legislative documents. When we are talking about law and regulation, they are they are defined. They define appropriate behavior, and they are the rules established by the state, both regulation and also the law, and they both are enforced to the full authority. So if there is any violation, there is a penalty as well. But the only difference is that regulation is the extension of the law. If there is something mentioned in the law and we are further elaborating on that or extending or breaking down into other articles and sub-articles, then that is called the regulation. But still the approval process is also different between law and also the regulations. This is how the process of legal document is happening in our country, in Afghanistan. So all these are legislative documents. If you are talking about law, regulation, statute, legislative decree, or government resolution, they are all legislative documents, and they are going through these processes. The first step is that you are going to write a bill or an act of about anything you want to establish in your country. So this is what initially the Afghanistan Nurses and Midwives Council Act was developed at this stage, and then this was reviewed. The act was reviewed, and it took us almost 7 to 8 years in these two steps only. Then in 2018, we were able to advocate, and everyone, including the president, the cabinet members, and also the National Assembly member, the parliament members, we have to talk with them, we have to advocate that we need the regulative body to regulate these two professions if we want a better health outcome for the patients, if we need a better health system for the country. So this took us almost 8 years to convince people that yes, this is a real need of the country. After that, the third step is that has to be confirmed that yes, whatever the act or the bill is prepared, that is as per the existing national and enforced laws. So if there is any deviation, any contradiction, any duplication, so there is a committee looking after it within the Ministry of Justice, and they prepare the final draft of the act. And then it goes into approval process. Here, if that is the law, then that goes to the National Assembly or to the Parliament for approval. And if it is a regulation, there is a cabinet legislation committee within the presidential palace, whose member is from the cabinet. They review the act, they review it, and if there is an issue, they send it back. If not, they approve the act, and the National Assembly approves the law after the cabinet legislation committee revision. Then that goes to the president for endorsement and signing, and after that, that is published in the National Gazette. So the purpose of showing this diagram was that if we need to develop something, we should not give up. It took us almost 8 years that we only had a draft of the act, a bill, waiting for the president to sign it and approve it and publish it. So 8 years plus the rest of the processes took almost less than 2 years for us. But this is an important part for every one of us as a nurse and as a midwife. So these are the important dates to highlight from the previous slide, that on June 18, AMNC design and business plan was approved by the Afghan cabinet, and on December we had our first assembly, and the interim board was formed. And in June 2020, the cabinet resolution number 8 endorsed the AMNC regulation, and on September 2020, the final presidential decree came out, and AMNC regulation was published in the National Gazette, and that is enacted today. As I said, that in December 2019, we were able to develop our 5-year strategic objectives, which is focusing on 4 main areas. since we were a newly body, a newly office, a new establishment. For that, we had to improve our operations. So operational excellence was one of our operational strategic objectives. And we also working on nursing and midwifery education and accreditation system, which I will be further discussing on these areas, and also the registration, licensing, and continuous professional development. And the fourth, the strategic objective of the AMNC is complaints handling and discipline. So the vision of the Afghanistan Nurses and Midwives Council is to be a significant regulatory body and partner in healthcare system of Afghanistan. It strives for excellence and innovation in midwifery and nursing research, education, and healthcare services to protect the public. Seeing the same vision, we have to develop our logo as well. So I'm also explaining our logo, so it should be clear. If you will see this logo, so you will be knowing that what does it mean, and even it will guide us if we are establishing any entity, so how we should consider every aspect of the vision of that institution. So we have used two colors in this logo, which is the purple color and also the navy blue color. These two colors are nationally recognized for the nurses and for the midwife. The blue color is the nursing color and the purple color is the midwifery color. And 2019 is the year of establishment, which is equivalent to our solar year 1398. In between of this, you can see the country name over here and two hands. Every hand, the purple color has the M, which indicates midwifery, and the blue hand has N, the letter N, which indicates nursing. These two hands protect a family, which represents the public or community. The outer circle, this indicates protection, that we, the nursing and midwifery profession, will protect the community, the public, encompasses protection of the public by midwifery and nursing profession. And this circle is converted into a vector, which means that nurses and midwives will keep rigid in terms of regulation, excellence, service improvement of those professions. And we also had the outer circle, which indicates our dream that we are reaching, that we are striving and struggling to reach a comprehensive care for our in all aspects of these two professions, in terms of education and also in terms of service delivery. This is a very much important slide in regard to the regulation and autonomy of the nurses and midwives. At the top right hand, you can see the leadership board of the Afghanistan Midwifery and Nursing Council, Nurses and Midwives Council. So this board, we have in this board 17 members. And luckily, majority of these members are nurses or midwives. This board is electing the president among the same members, from the same members, and it is in our regulation that the president, vice president, has to be a nurse or a midwife. So this is the most important part, that when you are talking or when you are developing or establishing a profession and anybody, you need to see who should be at the top. Then you can influence the policy. So the president is elected, who is looking after the operation of the executive director. And there is a subcommittee, the executive committee, who are all nurses and midwives, supports the executive director as well. Under the executive directorate, we have the nursing director, midwifery director, and also the nursing director and the admin and finance director. The area which you see the star, this means that currently we have only 5 staff who are hired and they are managing the operation of the council. Along with that, we also have the committees who are all volunteers. So these are volunteers, all volunteer positions, the light blue colors. But the green colors and yellow colors, they are paid positions of the Council. The Afghanistan Nurses and Midwives Council regulation has 24 articles and 5 chapters, so I'm not focusing on this area, but yes, it is important to know that what is the mandate of our council. That is operational regulation of the council and also to ensure public safety, as we discussed in the vision of the council, ensure availability of standardized professional education, oversee compliance to the national standards, and at the end, we have to improve the status of nurses and midwives in the country. The main function of AMNC, which is currently underway, and we are doing, these are major areas that we are working is setting standards and ensuring compliance, particularly education standards and accreditation standards, curriculum development and revision, accreditation of educational institutions, licensure examination, registration and licensing, complaint handling, discipline and research. These are the areas which is dominantly highlighted in our regulation, that these are the main functions that the council is bound to do in the country. Our financial sources are mainly the annual budget from the government we are getting, and also the contributions from the donors and other support institutions, and the council, its internal revenue from the accreditation fee, and also from the registration and licensing fee. So during last 1 year, some of the key highlights and developments which we had in the Afghanistan Nurses and Midwifery Council include, since we were the new establishment, a new body, so our main focus was on the development of internal manuals, policies, and guidelines. So we had to develop, and we have developed our internal systems. In regard to the education, we were able to revise the nursing curriculum and also revise the midwifery curriculum. Previously, the midwifery curriculum was for 2 years, but currently this has been revised for 3 years as per the ICM recommendation. In regard to the accreditation, since 2006, we had a board which is called Afghanistan Midwifery and Nursing Education Accreditation Board. It was established within the Ministry of Public Health to see the quality of nursing and midwifery education, ensure the quality of education in the public, particularly in the public sector. This was after the establishment of the Afghanistan Nurses and Midwives Council. The role of this board was handed over to the Afghanistan Nurses Council, and since then, we were able to accredit almost 32 assessments, which includes binding and non-binding assessment. And for that, we also trained 25 national assessors to assess these institutions. So as we discussed in previous slides, that we had a number of public institutions who are training nurses and midwives. So the quality of those institutions are ensured to these assessments, and we have 3 types of assessment. The baseline of once the new program is established or started, we do a baseline assessment, and we have a standardized tool for that. And the standards, we are looking that those standards are met. Then in between, we are doing the non-binding assessment, that whether the baseline is improved or not, or they have maintained the quality or not. And at the end, we do the accreditation or binding assessment. So these are the internal terminologies we are using in our accreditation policy. In regard to the registration, we were able to initiate the registration during new government and the new government, and luckily we were able to start it without any issue from the government. On 18 September, we were able to issue the first registration card, and currently almost 600 people are, 300 to 400 people are registered, and they have received their registration card, and 600 others are under process. And we are expecting that every nurse and midwife who are working or not working have to be registered with the council. This is our initial step, but yes, we are also planning to do the to take the licensure exam and also issue the licenses for those who are in the system and they are active in the system. Some of the key challenges during the establishment and currently which we have is the scarcity of the resources. Actually, this is a big concern for us now. Complexity of the procurement procedures, the government rules are very much complex. If we need a pen, we need to wait for 3-4 months until we get the approval to purchase one pen or one paper. So this is a big concern currently for the council. Secondly, the political influence. We saw that the number of private institutions are existing in the country, and they are currently still training nurses and midwives. And this is a real challenge to handle these institutions because majority of these institutions are belonging to the, also now the government is changed. We are really don't know what is going to happen, but in the previous government, this was a big challenge for us because these institutions were supported to parliament members and the cabinet members. So we were unable to have influence on those institutions. And there are always duplication of roles, whatever is defined for us in our regulation. Some other institutions and ministries are also having the same role. So if I will give you an example that accreditation of educational institutions, yes, currently we are doing only for the diploma level programs, but for the higher education, there is already an existing law before the AMNC regulation. There is a law, approved, enacted law, that they have the responsibility to accredit the programs, although they are the implementer and they are accrediting themselves, which is again another issue. And we are also raising this issue that this is not what should happen, but still these are happening. So we are looking how to resolve these issues. And some of these challenges are common to every nurse and midwife in our country. Missing leadership in the Ministry of Public Health. Currently, we have only the nursing department. In the previous government, we were able to advocate for two things in the Ministry of Public Health, and the previous minister agreed on those two things. One was that they will promote the nursing department to the nursing directorate. And the second one was that he will be hiring an advisor who would be a nurse or a midwife to the minister. But unfortunately, that did not materialize, but we need to take it back to the new minister and advocate for these two areas. Career leader is not existing in the country. The structure of the hospital and employment is always an issue. A nurse, a midwife is taking care of 20-25 patients. There is no nurse-patient ratio concern in any of the hospitals. So this is a big issue. The workplace environment is not convenient for our nurses and midwives. Higher education, as I said, is not existing to meet the need of our nurses and midwives. Particularly specialized education and CPD is a big concern currently. And the current challenges added upon is the brain drain. And unfortunately, we have lost very good nurses and midwives, and they have left the country. So considering these challenges and what is happening these days, we should never be tired of advocating for the profession and attracting the support from the national and international partners and agencies. And this is not only for Afghanistan, but also for every country who is working for the nurses and midwives. We will be focusing on the strategic objectives to achieve, and licensing is our second step that after registration we'll have to take it on. Handling private sector nursing and midwifery educational program is one of our agenda that we take it forward. In online registration, and we are dreaming maybe after 10 years or 15 years, we will have to look how we can bring the biometric registration for the nurses and midwives. One of the big issues in our country is that a nurse or a midwife is working in 2-3 areas, while thousands of other nurses and midwives are jobless. So this is a big issue, and we need to see how we can resolve it at this stage and a later stage through biometric system. And definitely amendment in the regulation, although our regulation is recently enacted and that is approved, but still they are of laws and regulation, and we are striving and looking at this regulation to become a law as well in the future, inshallah. So in conclusion, I can see that AMNC is a newly established entity, needs both technical and financial support from the partners and supporters. Thank you.
Thank you so much, Mr. Wase. This is Salima Gulzar and Anila Ashik Ali with me here. And there are a lot many other participants listening your presentation very attentively. So I am really thankful to everyone who have been such a lovely, attentive audience. With me, there are many questions coming in. So I would like to take you through with those questions and maybe you can respond one by one. So there are, somebody have given straight 3 questions. I'm going to pose through 2 of the questions first, which is very relevant. This is something about, the question is about the brain drain you have highlighted in your presentation as a challenge that you foresee already, right? So it is said that you noted brain drain witness in Afghanistan. 3 questions or issues that person has raised. What is the percentage of healthcare brain drain as well as shortfall in Afghanistan? Also percentages of women not in the healthcare system now. So would you like to respond this first? And the second question is also relevant. What is the shortfall in the region or the provinces? Where are particular shortfalls and what plan at the policy level? For example, the Ministry of Public Health recently noted that Afghanistan will continue to focus on the United Nations Sustainable Development Goals. So over to you, Mr. Wase.
Thank you, Ms. Salima. The first question, sorry, my power is off. The first question in regard to the percentage of brain drain of healthcare workers, actually we do not have any central database to retrieve the data about the healthcare. I will only give you an example of one of the private sector, the French Medical Institute for Mothers and Children. If you can see, during the last 2 months, or from 15 August until today, almost 85 healthcare workers. We have lost 100, but among them, 85 are healthcare workers who are doctors, nurses, or midwives who have left the country. So 85 out of maybe 600 healthcare workers. So you can calculate what is the percentage in one of the hospital only. So you can imagine about the other hospitals and also at national level as well. In regard to the second part of this question, participation of women, this is, we are lucky that the new government has never or not touched the healthcare facilities. So everyone who are working in the previous government and the hospitals and healthcare facilities, from day one, they were asked to be in their jobs. So this was a positive point in regard to the healthcare. But yes, in regard to the education, there is an issue still existing, and we are hoping that with the new rules, which the new government is working, people will go to their universities and educational institutions. I hope I have answered this question. And the second question was, I think, still I did not get the complete question. Please let me know if I have not taken it correctly. I think it was what are the shortfalls in the regions and the remote areas? Was this the question?
This was the question. It's particular about the provinces. The question was focusing on which province have major shortfall and which gender. I mean, about the women or the.
Well, thank you. Thank you, Ms. Salima, and thank you. I think this is an important question. Yes, the provinces, when we are talking, the more we are going towards remote and hard-to-reach areas, the more the difficulties, the more the issues are existing. Currently, one of the big concerns in all healthcare facilities is staffing and their salaries. So since even during the the previous government, the healthcare workers did not get their salaries for 2 months, and that is added in for the new government as well. So until now, unfortunately, they have not received their salaries, and this is a big concern for for them and for their families to survive. Number two is that although majority of the healthcare facilities are still struggling to continue, and we are thankful from the AKDN. AKDN is engaged in a number of provinces, particularly Badakhshan, Bamiyan, and many other provinces. They have continued their support. So now all the healthcare facilities which are running in these provinces, they are functional. And those other institutions and healthcare facilities which are expected to be collapsed if the aid is not received, we are really concerned about those areas. So we are hoping that the funds which were received during the previous government should be continued, although there is green lights coming from international agencies, but still the only thing we can do is to hope that it is not happening. And the gender is as well as I have shared that there is no issue in healthcare facility in regard to gender. So both the genders are going to for their jobs in all the provinces. But yes, the challenges are more where they are far from the capital of Afghanistan.
So thank you, Mr. Wais. I think this is nicely elaborated response to the question. The third question is about person have actually given the context and must have worked in Kabul. So that person is said that I worked in 2000s at the University of Kabul Medical College, which had a partnership with University of London, LSMTH, IOE, and UCL. What is the likelihood of such a collaborative program continue at the level of civil society? And what is AKU's plans to capacity develop healthcare professionals? So I think this is very, very important question, Mr. Wais, for you to respond.
Thank you for this question. Actually, this is what everyone is asking these days, that yes, the government structures are not formed yet, or they are in the process to be formed. And and everyone is calling upon international agencies and institutions and supporters that let's come up with such ideas, which you have put this question, whoever has asked this question. I think this is what every one of us is asking, and thank you for raising this, that why not to adopting the same strategies? Why not to engaging the civil society? Why not to engage the associations, professional associations? We have professional associations in every discipline. Why not to take advantage of the NGOs, non-governmental organizations who can even better implement such strategies for in terms of education and also service delivery. So this is, I think, a positive note the participants added.
Yeah. So thank you so much. So there are many questions coming up. The next is how the council is collaborating with the international donors, council members of the other countries like Pakistan, India, and other neighboring countries, given in the current political situation.
Sorry, Ms. Salima, I lost your voice.
Oh, all right. So I'll repeat, no issue. Are you, can you now hear me clearly?
Yeah, better.
Yeah. So I'll repeat how the council is collaborating with the international donors, council members of other countries such as Pakistan, India, and other neighboring countries, given in the current political situation.
Thank you, Ms. Salima. Currently, we have 3 supporters who are our active supporters in this regard, and they are helping the council. Number 1, WHO. Number 2, the Aga Khan in Afghanistan. They are supporting our trainings, and they are working on the capacity development of executive staff, office bearers, and also they are helping us in the development of key documents for the council. And we also getting support from the MSH as well, who has a project here in Afghanistan. So 3 active supporters we have. And during the last week, we really acknowledge the support from the Aga Khan University, who directly or indirectly supported in the establishment of the council, and also the Pakistan Nursing Council. The initial idea came from the Pakistan Council when we were developing the strategic plan for 5 years in 2019. That came from Pakistan Nursing Council and also Aga Khan University there. And during 2020, we got a chance to go and visit Bangladesh Nursing and Midwifery Council, and that was also supported through a donor. So we are looking how we can increase collaboration, not only among these organizations or council, but also internationally with other organizations. And we recently had also a meeting with some of the supporters from the USA, that how they can connect us to the through the ICN to other organizations, and come up with ideas for improving not only the council operation, but also the patient and patient outcome and education in Afghanistan.
Yeah, so and in regard to AKU contribution and the role towards Afghanistan, towards the nursing in Afghanistan, I see you, Mr. Wais, as a live example. You are our alumni. You developed as a leader, and mashallah, you are placed in a very important position in Afghanistan to lead nursing. So I think that is something, a live example for such a
Exactly. Thank you, Ms. Salima.
Yeah.
I'm not the only example.
Yeah.
Alhamdulillah, we
Yeah.
have many other examples. Maybe some of them are online as well. So we really acknowledge that, and this all the credit goes to our teachers like you and many others.
Thank you, but I think that's our role, and nurses. It says that nurses without borders. So we need to across countries and across discipline, we supposed to support nursing and strengthen each other. The next question is about something about the registration. It is asked that, is the council planning to implement an online registration process for registration or licensing purposes?
Yeah. Currently, we have started offline registration, but our database for online registration is ready. We have developed a very good and comprehensive database for the online registration, but the only issue is currently the funding, because the government is not releasing our budget, and we have also requested from WHO. WHO committed that they will support our online database operationalization, but again, the issue with them is transfer of money. They cannot transfer the money, so this is an issue. Yes, this is in our plan, at the top of our plan, and once we receive the fund, definitely we will start the online registration as well.
So probably the last question, Mr. Wais, for you, and it says that, how do you foresee the impact of current political turmoil on the regulatory activities of the AMNC, considering the funding limitation?
Thank you. This was an example that the online registration was at the top of our responsibility, or at the top to operationalize, but we were unable to do that because of the funding. But it does affect our operations, but ultimately what we have to do, we have to come up with other strategies, like we cannot wait for the funds. We have to adopt other strategies, and currently we have adopted the offline registration, and we are doing very good in that. But once we will be getting the fund, definitely we will be converting all those registration into online, and then people can apply or register online as well. So this is one example, and this could be applicable to other areas as well.
Yeah, I think yes, I think it's a when the projects are donors driven, financial sustainability is always critical area, and the issue all over the world is not only you, Mr. Wise, but this is the problem. And I think now people and agency and organization are thinking towards how they can be financially self-sufficient or sustainable. So there are models to learn, and that was with this. Uh, I have no more questions. We thoroughly enjoyed your session, and it was really, really thought-provoking, and we learned a lot. And seeing you on a very important role of a leadership positions really thrill and excited. And this is something a success for the nursing profession across border. So thank you so much, Mr. Wise, for conducting such a inspirational presentation for all of us. So with that, I'm going to hand it over mic to Ms. Anila Ashik, and she'll going to present the concluding remarks. So thank you so much, and Khuda Hafiz.
Thank you so much. Before that, I would like to thank you, Ms. Salima, Ms. Nasreen, Ms. Anila, Dr. Rafat, for everything you are doing for us. This is a good opportunity for our people, for Afghanistan, that they are getting advantage through online learning and those stuff. Thank you for this opportunity. Thank you for giving us the chance to talk on this important agenda. Thank you so much.
Thank you. Pleasure.